Hi, everybody. Thanks for popping on. I am Casey with NursePreneurs. Many of you have probably seen my face if you've been in our communities or on any of our lives in the past. I am here with Dr. Lev Grinman of Doctors for Providers. He is here to talk to us about the medical director and collaborating physician checklist for our RNs and nurse practitioners in business. Super helpful information. Thank you for coming, Dr. Grinman. And I will leave it to you.
My pleasure. Thank you, Casey. So what we're going to run through today is, as you said, a checklist of what you should have ready when you're going to be talking or connecting for the first time or the first couple of times with your prospective medical director or a collaborating physician if you're a nurse practitioner. And so that's the name of the lecture, Medical Director and Collaborating Physician Checklist, except it's in reverse. And we're going to talk about collaborations first. So a collaborating physician is somebody that nurse practitioners or advanced practice providers use. That physician must be licensed in the same state as the advanced practice provider. That doesn't mean that the doctor has to live in the same state. There are states that have proximity requirements, but most of the time that doctor could live in another part of the country, but they do have to have the same state licensure as the, let's say, nurse practitioner. In some states, the collaborating physician will provide prescriptive authority to the nurse practitioner. They will typically, on average, review a subset of charts. And it's usually 10% of all charts by that particular provider. There are some states that actually require collaborating physicians and advanced practice providers meet face-to-face at certain intervals, maybe once a quarter or less frequently, depending on the requirements. And in some states, collaborating physicians must have some physical proximity to the advanced practice provider. In some states, you have to be within the same state. In other states, you have to have a radius requirement. And the advantage of working with my company, which is Doctors for Providers, we specialize in finding physicians for collaborative and medical director roles. And we do have physicians in states that require physical proximity. We also have physicians who are able to physically meet, if needed, with the nurse practitioners. If a nurse practitioner is planning to prescribe, the collaborating physician will need to know the scope of the medications that are going to be being prescribed. For example, are there any controlled substances being prescribed? In which case, there's a DEA involved. It's a little bit maybe more liability on the physician. They may require certain knowledge of the controlled substances that are being used. So it's important to let the doctor know if you're planning to prescribe controlled substances. It's also important to know and let the doctor know if they will be required for insurance credentialing purposes. For some insurance plans, there may be a requirement to have a collaborating physician and to basically provide their credentials to the health plan in order for the nurse practitioner to become credentialed with the health plan. So it's important for the doctor to know what you're looking for as far as that's concerned. Also, on average, most of our nurse practitioners, the Doctors for Providers, will speak to their physicians 1 to 2 times per month. However, there may be instances, for example, you may be a new nurse practitioner with not as much real, practice experience as somebody else, or you may have some complicated patients frequently. It's important to let the doctor know if you're planning to speak to them more than 1 or 2 times per month, because the doctors obviously are usually busy with their own practices and other clinical commitments. So they will need to work around their schedule to speak with you and know when typically what your patient hours are to know that you may be calling them. And of course, the last thing I want to mention is that the doctor should have a similar clinical experience as the provider or as a nurse practitioner, let's say. In some states, that's actually a requirement. It doesn't necessarily mean that a psychiatric nurse practitioner must work with a psychiatrist. In many instances, you can work with a family medicine doctor because they have experience with prescribing psychiatric medications and treating patients for psychiatric conditions such as anxiety or depression. But you would not want to do a collaboration if you're specialized in psychiatry with, let's say, a pathologist or a radiologist, because they just wouldn't have that real life experience, and you may therefore would not be compliant, and you're also not getting the right type of doctor from a practical standpoint to work with you, and they will not be able to answer some of your questions.
Dr. Goodman, if I could just sort of put a plug in here for everybody. I appreciate when you highlight the clear communication piece, right? About what are your expectations as the APP and what are the medical director's expectations. And I think sometimes, especially as nurses who are new in the business side of things, I think one, we assume that the medical director we might be hiring, especially if we do it independently of a company like yours, kind of knows what they're doing. And I think that's not necessarily a good assumption to make. And so I think there's a lot of protection in going with a company like Doctors for Providers because, you know, there's some quality control there, and hiring someone independently off of LinkedIn, you know, off of Indeed or a buddy that you have or whatever can just get a little messy, especially when it comes to these expectations. So just a word of caution. I have seen personally some pretty messy medical director situations that didn't involve a company like Doctors for Providers. And so it's worth really evaluating that option.
Yes, thank you for that, Casey. And I'd like to add just two things to what you just said. Number one is you shouldn't be afraid to ask the physician when you're meeting with them for the first time what their expertise is, specifically as it relates to your type of practice. What we typically do, one of the things we always do at Doctors for Providers is we try to ask several questions about what your focus in practice is, and we pass that along to the doctor or doctors who may be interested in collaborating or being a medical director. And we say, hey, this type of provider is doing IV hydration strictly, or they are a psychiatric nurse practitioner prescribing stimulants for ADHD or something else. So we try to let the doctor know what your practice involves, but it's really should be also in your hands to ask the doctor, hey, are you comfortable with this and that I'm going to be doing, types of medications I'm going to be prescribing? And if there's any hesitation, the other advantage of working with Doctors for Providers is we have other physicians for you. Right. So if the first one doesn't work out, either in the interview or even if you start with them and you feel like after a month or two that you're just not jiving with them, we can replace that physician at no additional cost.
Yep, which is very nice too, because just like any relationship, it sometimes it works and sometimes it needs adjustment.
Yeah, exactly. 100%. So let's switch now to medical directors. What are medical directors? At Doctors for Providers, we provide medical directors who are typically offsite or remote medical directors, and these doctors can review and sign off practice protocols. They can review charts. Sometimes they will order medications for the practice that they're working with, such as IV hydration products, botulinum toxin products, ketamine, et cetera, whatever is required for, let's say, a nurse-run practice. The physician must be, again, licensed in the same state as the provider or the practice that is being overseen. Again, the doctor can be in a different part of the country many times, but they do have to be licensed in the same state as where the clinic is, and specifically, especially where the patients are. When you are speaking to a prospective medical director, it's important and I think beneficial for everybody involved to be willing to discuss various topics related to you and your medical business or your medical practice with a prospective medical director to show that you are serious and prepared. And of course, also to make sure that the medical director is prepared and knowledgeable about the type of relationship they're entering in with you. it's important to discuss the services that are being offered. So, what services, for example, in IV hydration, are you going to be using any unique formulations or products in your mix? Are you seeing any particular, types of patients that are normally not seen in an IV hydration clinic? Um, for a med spa, you would want to discuss, well, what exactly is included as part of your med spa? Is it botulinum toxin injections, fillers, lasers, or anything else? And the reason that may be very important is not only are you giving the breadth of what you're doing to your medical director, the supervisory rules may be very different from state to state, depending on what you're doing. So are the rules for supervising Botox and fillers may be one thing, but the rules for supervising lasers may be completely different. The doctor may need to be in the same state, or maybe within the very close proximity in some states when they have to supervise lasers. And also the physician's experience um, must be documented as having experience with certain things in some states. So it's important to discuss everything that you're going to be doing as part of your medical spa. Weight loss, you're going to want to discuss whether you're using the classic stimulants or the now very popular semaglutide as your offering, so the physician, again, knows what they're getting into. Um, Other items to discuss. Do you have a business plan? Even though it may sound complicated, if you have a business plan and you can let the medical director know, if you're especially if you're starting a new business by yourself, it shows that you're serious. If you do, uh, you would want to discuss with the prospective medical director whether you will be expanding your offering. So you may be offering IV hydration today, but you may want to do other med spa things in the future. So it's important for the doctor to know, one, to know how much more they're going to be overseeing, and also to make sure that they're comfortable uh, supervising the things that you're going to be offering in the future. You're going to want to talk about the number of providers that are going to be in your clinic, and whether you're going to be adding other providers in the future and what the timeline of that looks like. That may be important for different reasons. If you're adding, let's say, advanced practice providers such as NPs and PAs to, let's say, a med spa, there in some states there are limits on how many advanced practice providers a physician can oversee at one time. So if they are being close to being maxed out on the mid levels or advanced practice providers, I'm sorry, that's the old term, then they may not be able to help. So it's important to know that they have the ability to take on additional advanced practice providers and also to oversee more RNs or whoever else is going to be administering your services. Um, you're going to want to discuss plans if you're planning on opening other locations. You're going to expand your footprint. It's important to let the doctor know because they're going to have to approve the protocols for that location, oversee probably more providers at that place, and also make sure it's in a geographic location that they can supervise. And of course, you want to let them know what the opening of your clinic is and what the start date is. Sometimes, and Casey, we've discussed this before, um, when somebody's opening their clinic for the first time, they may be nervous and may think that, look, I need to start looking for a medical director way, way in advance. But the truth is that it's probably one of the last things you can look for. For example, Doctors for Providers, we can often source a medical director or collaborating physician within a few days or maximum a couple of weeks. And so you may want to have all of your other ducks in a row. You may want to make sure that you can open your doors and start seeing patients, because the medical director may not be available 3 or 4 months from now. You may not be able to lock them up. So don't think that you need to start preparing for the medical director way, way in advance. It can be within 1 month of getting ready to practice.
Exactly. And maybe at some point during this presentation, and I'm sorry, I feel like I'm about to sneeze, so I apologize if I pause
Okay.
for a second. But at some point, maybe during this presentation, we can talk about the one maybe exception, or we can talk about it now, which is, I think we talked about before, if you're in a state that requires an MSO, MSA, it might be worth just checking in a little sooner because you guys
100%.
have some
Yep.
ability to help there.
Yes.
But also, I want to caveat that sometimes new business owners are not clear on the fact that you guys, as doctors for providers, are not a healthcare attorney. And I just want to throw that out there that because I think a lot of times the nurses, and I'm getting a lot of these questions recently, they're trying to seek advice from companies like Doctors for Providers
Yeah,
and it's really advice that you need to get from your personal healthcare
yeah.
attorney. And so those two things are separate and both necessary if you're starting a business.
100%, Casey. And that's actually the healthcare attorney is my next item.
Okay.
It's very important. We always recommend that you have a healthcare attorney to prepare all necessary contracts. It is obviously an expense, but it's like laying the bricks for a house. If your house is not sturdy, it can fall apart. And so it's very important to have the right guidance, and an attorney is one of those things that we think is really important. Yes, one of the things that we have an advantage at Doctors for Providers is we have our own attorneys, and we can ask them general state law related questions. And we can pass that knowledge along. However, it really is best to hear it from the horse's mouth, meaning your own attorney. And also, sometimes we do encourage our clients to talk to their state board, to talk to their nursing board, because rules change all the time. And we may think we have the latest rules, but they may have changed a week ago. So sometimes it's good to confirm with your own nursing board to make sure that you're compliant and you're doing everything correctly, not just as it relates to contracts, but as far as what the supervisory rules are. So it's better to be safe than sorry.
Exactly.
Of course, we're going to try to help as much as we can, but you should go to the source.
Yep. I just want to say thanks for that, because I think everyone gets a little overwhelmed, and it feels easy to say, well, Doctors for Providers said blah, 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 or this company said blah, blah, blah. But again, always double confirm everything, because when it is all said and done, it's your business and your business,
Yes,
your LLC, your license too on the line. And
100%.
Yeah.
100%. We would never want to put anybody's license on the line, whether that be our clients or our physicians. And that's why we always encourage proper compliance and not just go by hearsay or what the company may have said. Yes, we're not attorneys, even though we talk to attorneys, we're not attorneys. So that's a very good point. The next point is about malpractice insurance. You should have a malpractice insurance broker to cover yourself. At least we at Doctors for Providers do not provide malpractice insurance to the supervising doctors. And so when you work with us, you should have the ability to not only cover yourself and have those quotes for yourself, but also know that you're going to need to cover your medical director. And so just be prepared for that. It's usually not expensive. Sometimes it's free. Other times it's not free. But usually the cost is not significant, but you should be ready to do that. You, of course, just in general, if you're starting your own business, you should have all other business expenses covered, and business insurance, such as general liability, should also be there. Of course, set up your business entity, such as an LLC, and have a bank account set up, because you're going to be needing it to put deposits in when patients pay you. So all of those things, and the medical director may ask you that. And again, that just shows that if you have all those things set up, you're getting very close to opening your doors, and you're ready to start business. As Casey had alluded to, I just briefly wanted to touch on the topic of MSO, MSA. This is a topic that causes a lot of anxiety for some people and can be fairly complicated. And it is one of those things that if you fall in the category of somebody who is in a state with strict corporate practice of medicine rules, these states are known as CPOM states. For example, two examples of two big states that have them are Texas and California. In those states, if you're not a physician, you are not allowed to contract with or hire a physician for services. So what most people do, the workaround to this, is for your own business to become what's called an MSO, or management services organization, and then you will contract with a physician's own professional corporation or professional limited liability corporation. And so this allows you to be compliant with the state. It also is important to emphasize that just because the physician enters the picture as an owner of a medical practice doesn't mean that the physician gets to keep most of the money that comes in through the practice. Essentially, the MSA, or the agreement that you have with the physician's practice, allows you to take money out based on the tasks that you're performing as a management company for that business. And also, anything that's not clinically related can be expensed through your own company. We have a whole page dedicated to CPOM on the Doctors for Providers website. If you want to visit that, we have a lecture on there also as well, just talking about the basic structure of an MSA MSO relationship. Again, I want to emphasize that this is a sophisticated setup and requires several more contracts than a simple medical directorship or collaboration. And so it's even more important, or almost impossible, not to do this without an attorney involved. And
And
so,
I just
and
dropped that link to that page in the chat,
thank
Dr.
you so
Goodman.
much.
You're
Thank
welcome.
you. And yes, as Casey was saying, because the MSO MSA setup sometimes does take several months, that is one of the few times where you will want to look for a physician PC owner ahead of time, more than a month in advance. You probably want to give yourself, at least 2 to 4 months, so that you're safe and can, get things set up quickly. The physician's PC may already exist. And if it doesn't, most of the time, again, it's not a long process for the doctor to set it up, or for you to help the doctor set it up. But you have to do it together, though. But in some states like New York, it may take up to 6 months because of administrative hurdles to get a new PC opened. And so in a state like New York, you really need to prepare way in advance. But fortunately, that's one of the minority states where that's the case. And you will need to negotiate, or basically put in the MSA contract, what you're able to draw from the professional bank account every month as the manager of the PC. Next item is good faith exams. So let's say you're an RN and your patients are receiving certain services by prescription, or they're essentially considered medical services. And IV hydration in most states, or almost all states, is considered a medical service. Same thing for botulinum toxins, even if they're used for in med spas. So these patients will need to be examined prior to the initiation of therapy, and sometimes more frequently. Sometimes in some states it has to be with every use of the medication, though in most states it's at least annually after the initial exam is done. And these are what's called good faith exams. These can be performed by physicians or advanced practice providers. Some practices have these professionals, providers, come in and do it in person, or they have them on contracted or on staff. And it's important to note that when you are taking on a medical director or remote medical director, the remote medical directors will almost never have time to perform the good faith exam. So you need to know how you're going to be compliant with those. There are, fortunately, now telemedicine solutions available. And these services vary in how they bill. There could be a fee per exam, and some of them also have a monthly membership fee. Often these exams do not come with prescriptions, however, but that may change in the future. And it's important to tell your prospective medical director how exactly it is that you plan to stay compliant with all necessary exams. And the last time we checked with our attorneys, which was literally a week ago, they confirmed that every state requires good faith exams for the things that we just described. So you have to stay compliant.
So important, because I just want to say, one, this is another thing, probably similarly to MSO, MSA, that causes a lot of stress for the nurses that I interact with in our communities. One. Two, that's huge to know that essentially, at least, according to Dr. Grinman's attorneys at Doctors for Providers, you got to do it in every state, and you need to understand the stipulations Because I think the other piece of this is that if every state requires them, it doesn't necessarily mean that they require them to the same degree or at the same
Correct.
intervals or frequency, et cetera. So every nurse business owner's responsibility is to understand and stay up to date with the laws and regs in their own state. I just want to put that out there because we've had so many questions about this recently.
100%. And I know that more and more states are putting out statements as it relates to good faith exams when it relates to IV hydration, for example.
Yeah.
So they're really trying to make sure that things are being done compliantly. And yes, states have different sort of rules and they're also evolving. So it's important to understand from your nursing board or the medical board what the latest rules are as far as how frequently and how the good faith exams need to be done.
Yeah.
Because we understand how important good faith exams are for you guys at NursePreneurs, for example, we've actually recently partnered with a very good good faith exam company called Qualify. They are currently in 40 states and probably expanding further. They can do good faith exams for 60 plus procedures. And the exciting part is that Doctors for Providers clients are going to get the lowest possible rates in the industry for these good faith exams. They're so low, we're actually not allowed to discuss how low they are on this webinar. But if you speak to your account coordinator or if you register with Doctors for Providers and become a client, we will let you know what that rate is. It'll be good for at least a year, and it'll certainly be good savings for you.
That's exciting. Because a lot of people, I mean, that's another thing that I think a lot of our community asks frequently, because it's overwhelming sometimes it's overwhelming how many different services you might end up needing. You need your lawyer and you need your medical director, and then you need your good faith exam, provider, and they're not always one and the same or connected. So I think simplification is nice where we can for our nurse business owners. So that's a big one.
And the last thing I want to say about Qualify is that their exams are instant. So once you log into their portal, you'll be able to get an exam done right away. There's really no wait. Last thing I want to say, I guess it's a plug, but it's an important one. We at Doctors for Providers, we're running a limited time promotion. You can save up to $500 on your first year fees, which is a significant amount. And your account coordinator can let you know what those are. We do not charge any matching fees for non-ownership medical directorships and collaborations. And again, if you require any assistance with sourcing your next medical director or collaborating physician, please feel free to reach out to Doctors for Providers. You can register directly on our website as a provider, and we'll be more than happy to talk to you.
Awesome. And just so everyone knows, I just put that link directly to their page. And I also added in a blog that Dr. Grinman and his colleague had shared with me previously about making the most of working with Doctors for Providers. So you can kind of be prepared if you're going to book a call to chat. You can have that sort of as your framework before you head into that call.
Yep.
And then again, the MSO, the CPOM state page with you said you have a presentation on there, is in the chat as well, everyone, because I know half of you are going to jump off here and go straight to that because you're dying for more information on it.
Yep. You're welcome to look at that. And we work with, for the MSO part, we work with a lot of doctors who are very knowledgeable about the MSO structure and can also be medical directors. We also have other partnership with companies that can do the ownership for you, and Doctors for Providers will provide the directorship part. So there's different ways we can skin a cat, so to say, and we're able to help with the MSO stuff. And
I know we harp on this a lot, but I want to say, again, my caution for those who are thinking about going in a kind of a private individual arrangement direction for their medical director is MSO and MSA stuff is sort of, that's like business ease, so to speak. There's legalese, legal chat, legal talk, and this is very business chat, business talk. And someone who's advertising themselves as a medical director on, again, Indeed, or that you find somewhere else, they probably are a great physician, let's say. They may have no idea that that CPOM exists. Okay, lots and lots of medical providers don't know what it is. They've never heard of it. I'd never heard of it before I started working for NursePreneurs, and yet I've had multiple sort of starts and stops of starting a business, and yet hadn't heard of it. So my caution is that hiring a medical director can be a little bit tricky if you end up hiring someone who doesn't even know that that exists, because you guys can both get in quite a bit of trouble if a relationship is uncovered that doesn't comply with CPOM, regulations. So moral of the story is, again, do your own research about what's required in your state, and then consider, again, using an organization like Doctors for Providers, because you're getting all of that experience and knowledge that you may not be getting when you hire someone as an individual separately.
That's right.
So anyone have questions, you can pop them in the chat. We can steal a little bit more of Dr. Grinman's time here for a couple minutes. If you would like, I'll wait here for a minute and see if anyone pops up. Can you see the chat now too, Dr. Grinman?
I'm going to pull it up in 1 second.
Don't worry if you can't, because I've got it.
No, can't see it.
That's okay. I've got it if we need it.
Awesome.
One person had asked, and I already answered they had asked about mobile good faith exams, or Zoom or virtual good faith exams if they are a mobile company. And my response was that generally, yes, that's fine. But again, same thing that we keep talking about is you always have to check your individual state laws and regulations.
Yep.
And check with your board of nursing and your medical board. Those are all kind of places to continually be checking. Really, it should probably be on everyone's calendar once a month, or once every couple of weeks, to just go back to those sources and make sure nothing has changed.
Agreed.
And again, that's where I plug again, making sure you have a good healthcare attorney, because hopefully they're also keeping you in the loop with things that are new and changing.
Yep. And we have some attorney resources, attorneys that we're comfortable working with, on our resources page at Doctors for Providers as well.
Oh, that's great. I'm actually going to grab that page right now. Provider resources, right?
Yep. There's a lot of helpful things on there.
Okay. I'm going to drop that in the chat too, because the attorney piece, again, is another one that comes up frequently. So it's nice to have some recommended resources. Anybody have questions? Give you a 30-second countdown. Thank you for coming in again, Dr. Grinman. That was great.
My pleasure, as always. Thank you so much, Casey.
Yep, thank you. And if anybody needs to get a hold of them, I already dropped it in there, but you also, if you're in our NursePreneurs community, you can always tag me. And you don't have to look very hard to see my name in there, because I'm constantly in there. So you can always tag me if you just have a general question, and I can get a hold of Dr. Grinman as well to clarify anything that you need, or get you the resource that you might need to help you answer something. So let's see. Someone said, I'm actually already a Doctors for Providers client. I was wondering about sending charts to the collaborating physician. I know it changes from state to state, but my CP said only 5% of charts needed to be sent to him.
It's quite possible. It all depends on what state you're in and what the rules are. So it's some states may not have a set percentage. Some states it's certainly possible that it's 5. I wish I had memorized what the requirements are in every state, but I don't. So I know on average between all 50 states, it's about 10%. But it's quite possible that 5% is sufficient.
Okay. Haley, I hope that helped. Anyone? I know that last question rolled in right at the end before I was about to end the stream. So I just want to make sure everyone had their questions answered. Again, reach out to me, tag me, or go to their site if you need any more information. Haley said thank you. So good. Okay. Well, thank you. I'm going to end the stream. Thanks so much for coming. And hopefully we can do something like this again soon, Dr. Grinman, because I think everyone appreciates the info.
You got it.
All right.
All right. Take care. Thank you. Bye.